and welcome to a presentation of the Lensomatic device, also called LOM, L-O-M for short. The LOM is a simple yet effective device that facilitates the insertion of contact lenses into the patient's eyes. This innovative device takes advantage of the fixed relationship between the patient's bite and the patient's eyes. By using the bite as an anchor point, the LOM accurately and repeatedly positions the contact lenses in front of the patient's eye for an effortless insertion. Here's how it works. Using a small plastic tweezer, gently grab and place the contact lens onto the LOM suction cup. Then, open your eyelid with your fingers to the LOM base to position the contact lens in front of your eye, and then squeeze the air bulb to gently deposit the contact lens onto your eye. It's that simple. Repeat for the other eye. Place the contact lens onto the suction cup, open your eyelid, bite the LOM base, and squeeze the air bulb to insert the contact. The LOM device consists of three main parts. First, the mouthpiece, which, held firmly between the patient's teeth, positions and secures the suction cups precisely and repeatedly in front of the patient's eyes. Extending above the base, a pair of adjustable arms allow the LOM to be adjusted to any patient's facial dimensions and features. Finally, sitting on top of the arms, the insertion assembly allows for gentle insertion of the contact lens into the patient's eye. The insertion assembly has three main components, all mounted on the insertion guide. First, the silicone suction cup, which holds the contact lens in place during the insertion process. Note that the suction cups are vented to allow for the immediate release of the lens upon contact with the eye. The second component is the accordion-looking silicone bellows, which extends to move the suction cups from their resting positions toward the patient's eyes, and then retract back to their resting position. Finally, the silicone air bulb, which when squeezed extends the bellows and suction cups forward to softly deposit the contact lens onto the patient's eyes, and, when released, retracts the bellows and suction cups back to their resting positions. There are several benefits in manipulating the contact lens with a pair of silicone-tipped plastic tweezers. First, you greatly reduce the risk of contaminating the contact lens with uncleaned fingers, and you also eliminate the sometimes laborious task of grabbing the lens from its case and placing it correctly on your fingertip. There is also less risk of damaging or losing your contact lens during insertion. Because the suction cup, bellows, and air bulb are all made of soft silicone, and the extend-retract motion is air-activated, the insertion of the contact lens is very smooth and gentle, putting no undue pressure or sudden touch to the patient's eye, regardless of how fast the air bulb is squeezed. And as you can see, the contact lens releases from the suction cup immediately upon contact with the eye. This device can also be used to drop medicine into your eye without missing and wasting expensive medication. This is done by replacing the insertion assembly with a clip-on bracket. This device is called DOM, D-O-M. To instill drop into your eye, simply snap on the medication bottle into the clip-on bracket. Bite the mouthpiece, tilt your head back, and squeeze the medication's bottle. This device has several benefits besides its ease of use. First, there is no contact between the bottle, the eye, and the areas surrounding the eyes, which removes the risk of eye infection contamination. And patients with unstable hands, like older people, which are more prone to use eye medications, can easily and safely instill their medications by themselves, even with poor eyesight. This was a presentation of the Lensomatic and Drop-O-Matic devices.